Good morning, everyone. My name is Lisa Friedlander. I'm the Chief Revenue Officer over here at Next, powered by Shulman Rogers. Welcome to our April Pitchmasters workshop. Pitchmasters is a partnership between Next Raise and SeedSpot, and we are excited today to have some fabulous entrepreneurs that are going to be practicing their pitch and getting feedback on how to make it better, both in terms of the deck and the pitch. So we're super excited to have everyone today. Thank you for joining us. This session is recorded and will be included on Next website as well as on our YouTube page. I am very excited to have today some fabulous entrepreneurs. First up is Sharon Celeb. And Sharon, we're having some technical difficulties, so I'm going to share my screen for you, and you'll just go ahead and let me know, when to advance. So let's try it this way. Can everybody see my screen?
Yes.
Terrific. Thank you, Jackie.
I was going to say the same. Sorry.
That's okay. All right, Sharon, let's kick us off, and hopefully you and I will be able to make this work. We apologize ahead of time for any idiosyncrasies.
Well, good morning. My name is Sharon Celeb, and I'm the founder of Tush Toners Body Sculpting. Next. At Tush Toners, our mission is to uplift the world one butt at a time by creating an entirely new category of weight loss, at-home, non-invasive body sculpting. Over 70% of Americans are overweight or obese. That's approximately 180 million American adults that are overweight. That number continues to climb every year, along with a $72 billion weight loss industry. It's abundantly clear that folks are desperate for solutions, and the ones on the market just aren't cutting it. Until now. I started Tush Toners about 2 years ago in a 100 square foot studio in Chicago doing in-person body contouring to clients. I had no marketing budget, and it was in the middle of COVID. Despite all this, I generated over 100,000 in sales. Since then, I've had over 500 unique clients of all shapes, sizes, body types, ethnicities, from 19 years old to 72 years old. It was whether people wanted to come in for cellulite reduction, tighten their arms, lose inches off their waistline, Tush Toners was able to deliver amazing results. We accomplished this through ultrasonic cavitation and radio frequency, which has been around for about 2 decades and proven in weight loss and skin tightening. Ultrasonic cavitation creates sound waves under the skin that heats up the fat and causes it to liquefy and naturally drain through the lymphatic system. The radio frequency is a proven skin tightener that helps promote collagen production. I knew I was onto something, but in order to tap into the largest total addressable market possible, I realized that we had to do a strategic shift in order to really capitalize on as many people as we can, not just only folks in Chicago. So Tush Toners at Home was born. I worked with a manufacturer to design and customize the machines that I use in person in Chicago. Again, without any marketing or advertising budget, I've sold over 40 units, generating 50,000 in sales, with a near 90% profit margin per machine. The units retail for $12.99, and they also come with training and user manuals, so customers have an understanding of how to use the machine if they've never done it before. The at-home market space is really nascent. The competitors range from tens to hundreds of thousands of dollars medical grade machines, or several $100 machines that you could get directly from the manufacturer overseas on Alibaba or DHgate. There's no national non-invasive body contouring chains. It's only plastic surgeons, mom and pop med spas, but nobody owns this space at all. The opportunity is pounding at the door. The global body contouring market is over $7 billion globally, and that only accounts for medical grade machines, not for at-home machines. But Tush Toners doesn't just want to sell machines. We want to close the loop on the disjointed weight loss industry by creating software to prompt usage and track and create a community around body contouring and weight loss. In order to get the best results, the machine has to be turned on. Human nature can make it oh so easy to slip into bad habits and skip workouts or body contouring sessions. But with an app to create and customize a service plan for each individual and prompt usage and have the ability to upload progress pics makes it so much easier for folks to achieve their desired results. In order to get the word out, we're going to heavily focus on social media and paid ads. Instagram and TikTok are the go-tos for all things beauty and the latest trends. We are seeking a $1 million investment to reach 5,000 customers to generate $6.5 million in revenue, giving a 2-year runway. With nearly $250,000 in total revenue that I've generated since Tush Toners opened just 2 years ago, the model has been validated. People of all ages and demographics desperately want to improve their appearance and body. Body contouring is the solution to reduce stubborn fat when exercise and working out just simply don't. By investing in Tush Toners, you'll be a part of the missing links that helps folks to achieve their dream body. Tush Toners' vision is to be the central hub for all things fitness and ultimately partnering with larger brands like Peloton, Fitbit, and other apps to collect data and track progress in the pursuit of weight loss. Though I'm a solo entrepreneur, I regularly consult with my advisory team, and we look forward to the next phase of Tush Toners' growth. Do you have what it takes to uplift the world one butt at a time with me? Oh, I can't hear you.
No, I was on mute.
Okay.
Thank you so much for the presentation. I think we made it through, maybe not as gracefully as we could, but thank you for that. Few comments from my perspective, and then definitely we have time to open it up to the group here for some feedback. I think primarily what I'm missing from in your presentation is some sort of science, whether it's a study that you've done yourself, whether it's actual data on the machines that have been purchased, the usage of it, the results that have been given. There's so many of these things out there in the market, maybe not exactly what you're doing, but so many companies sell products to, get rid of cellulite and this and all. And studies have shown time and time again that they really don't do anything. So I think you have a big hurdle to overcome in terms of the actual effectiveness of purchasing a $1,300 machine at home. So to the extent that you have data or studies that you've done, I would include that. If you haven't done it yet, then I would focus on that with some of your user group of the numbers that you've had. Maybe give away your machine for a little bit to try things with different groups of people. Any way that you can get more data to really show. You have some of those photos. For me, maybe it's just because I'm on my computer. A lot of them looked awfully close in terms of the before and after. I think the good news is this is as you noted, a multi-billion-dollar industry. I like the way that you've tied it in with workouts and exercise and health to try to keep it more positive in terms of this is not a body imaging, body sculpting is not the end. You have to be healthy. You have to exercise. You have to do all these other things. I think that's important as well. To me, I would not focus on your app right now. I think you've got a lot of fish to fry to get there and get into the market. I think the app could be something, a little bit further down the road. But generally, congratulations on all of the success so far. And I'm excited to see where it goes. So I'm going to open it up to the group. Anybody feel free to either raise your hand or Unmute yourself, Catherine, go right ahead.
Hi there, Sharon. Catherine Kavanaugh here. I direct Screen 360 TV, which is a startup, and I'm pretty much a solo entrepreneur like you with a group of advisors. I've also taught at Stanford D School and the D School in Potsdam, Germany. So this is giving feedback is regular for me. So congratulations on bringing it this far by yourself with a group of advisors and sticking with it. Let's see, I agree with Lisa about data. And one thing you might consider is what's called a cultural probe. As Lisa suggested, giving the machine to a few people, have them do that and record a week by week. If you can get a friend or family member to do that. And then you've got qualitative data. That is very useful still with people, and to use images, as Lisa said, some were close. I saw the difference in your before and after photo, but do a before 1 week, 2 week, 3 week, so you have more realistic data. Let's see, not focusing on the app so you can focus on data. I think that's great, but it does sound like you've done a lot of thinking about your product, and it is full circle. I want to ask if you have done some, what kind of testing have you done? Because it does seem like you have done some testing.
Yeah, I mean, honestly, it's all just anecdotal. Everybody, like I've been doing this a little over 2 years, and when people do inch loss on their stomach, 99% of people lose at least a half inch to an inch in their first session. Whether or not they maintain it is another story. But from the 500 people that I've had, probably,
So 500. Mhm.
yeah.
Okay, right. And you've given classes, so that is testing.
Yeah.
That is testing. That's great. I wonder if you could draw more data from that. You've done pretty good as it is. Yeah, and that qualitative data also, quotes from people speaking about it, and really useful. And just one tiny little thing, one of your advisors had sunglasses on. And I thought, oh, why does he have sunglasses on? So maybe you might want to ask him to give you a picture without sunglasses. So good luck. That's all from me.
Thank
You,
you,
Catherine. Thank you. Does anybody else have some feedback for Sharon?
Hi, my name is, I'm sorry, go ahead. I'll let Jackie go.
It was just something that I was reading over the weekend. Linda Evangelista made this cool scup famous with disfiguration. So do you have any safety information to add?
Great point. I saw that as well.
Hi, I'm Paul Shulman, entrepreneur, also a future presenter on this vehicle here. But I was just curious, I saw in your budget that you had something about IP or patents, and I'm just wondering if the actual technology that you have, the machine, is there patents for that technology? You know, can it be knocked off easily or not?
Great question. Sharon, any IP in the machine that you've built?
No, there's not. So it is an existing technology, but I've worked with the manufacturer to customize and eliminate some of the functionality. So it is a unique machine. That's why I think you need to raise money to see if it is patent pendable, because it is the motherboard of the machine is manipulated.
Mm-hmm. Got it. That's a great point, Paul. Thank you. Sharon, have you thought of like a Kickstarter or equity crowdfunding at all?
Yeah, I just think that it seems like, I don't know. I'm not sold on that idea personally. For me, I feel like it's going to be so much more work. I don't know.
Well, it has a way of dually getting to your market as well as either raising money on the Kickstarter side for a product, and on the equity side for granting equity. Any other additional comments for Sharon?
I was just going to comment. Hi, everybody. Sorry,
Hi, Karen.
a little crazy today, so I'm not going on camera. My kids were up like all night. But But I do want to I actually did I'm hoping to pitch to you guys in June eventually, if I can get into that spot. But I didn't do equity crowdfunding yet, but I just a couple months ago finished an Indiegogo campaign. So I would be happy to talk with you about that route because I actually didn't know what I was getting into until I got into it. And it's a ton of work, but it's really interesting and it's a cool path to take if you're trying to, especially from friends and family who just want to see you succeed. So I'm happy to, if you want to get in touch with me, I'm sure Lisa can give you my info.
I can. Thank you, Karen. That's really nice. Any other feedback for Sharon on her pitch or her deck? The deck looked really nice, Sharon, by the way. Didn't comment on that, but the design, the colors, there's not too much wording, on each one. It really came through powerfully. So the deck looks really nice.
I agree with that.
Yeah.
Yeah, nice space.
Thank you.
Any other comments for Sharon before we move on to Jackie? Okay, Sharon, any questions about any of the feedback that you've gotten or clarifications or anything?
No, it was really good feedback. I have heard similar things before, and it's always a matter of what is the most important thing to put in, a 5-minute pitch versus 15. So I appreciate everybody's time and honesty. I really do. So thank you.
Yeah. I think that for you, like the core takeaways, if you're for an investor to be interested, for me, I want to know that it works, right? And I want to know what proof you have that it works. And then I want to know what your go-to-market strategy is. So, how are you going to get these $1,300 machines in the hands of millions of Americans? And the pitch was actually a little light on that piece. Your advisors were at the end, but you didn't really talk much about them. So since you're a one-woman show, or at least for right now, you don't have a full team, I think it's important to mention at least, if not go advisor by advisor, but the expertise that your advisors bring to the table would be helpful. But great job. All right, next up we have Jackie Cohen-Roth. Jackie, whenever you're ready, feel free to share your screen.
Let's see. It's not going into presentation mode. Know why this is. Let me stop share and share again.
Oh, you know what? Hold on, Sharon. Oh, okay. Did I?
Okay, wait. I'll try mine again. Boom.
Okay.
Share. Present. I don't know what to do about that. It's been working. So in any event, I'll run through as.
That's okay. We'll run through it as is.
As is. Okay, well, to get going. So I am Jackie Cohen-Roth, and I'm founder, CEO of an ongoing medical cannabis education platform that I launched with a tweet December 2017 when Maryland's medical cannabis program went live, and we have been a revenue generating entity since the beginning. The mission of Cannabis MD is to educate, build, and engage an ecosystem of cannabis industry stakeholders to deliver optimal patient outcome. We're committed to filling the void of cannabis science and policy education via workforce development for entry into this high growth industry with workforce development, physician advanced practice, provider education, and as well as education for industry senior leadership. We're currently delivering cannabis science and policy education. We have a monetized platform, as well as I deliver and offer consulting services. For those that are familiar with the cannabis industry, you'll recognize some big names that partner with me on our educational programs. What I'm raising money for is to build out programs that I have developed, grants that I have applied for, and then growth in the education sector, particularly in healthcare, pharmaceutical, and the biotech industry. Why now? The medical cannabis industry is booming with a projection of $248 billion by 2030 with close to a 32% CAGR. The medical, continuing medical education industry itself is worth $9.2 billion. The Annals of Internal Medicine report that the number of medical cannabis patient enrollment has quadrupled from 2016 to 2020. There is projection from May 2021 where there were close to 6 million patients registered. We now have 38 medical state programs across the US. If we have medical cannabis legalized in every state, using a metric that is very common in the state programs when they project their patient census, it will be close to 9 million patients in the US. And then at the end of 2022 is very exciting. We have our first standalone piece of federal regulation, which is the Medical Marijuana and Cannabidiol Research Expansion Act that was signed by President Biden. And what this is going to do is help deliver what has been missing in the industry is the peer-reviewed, double-blind, placebo, gold standard research. So what we're focused on, again, is education, and education impacts outcomes. Cannabis is the most commonly used federal legal drug in the US, with close to 50 million people, or 18% of Americans, having reported using cannabis at least once, and this was back in 2019. Because cannabis is federally illegal, it lacks federal oversight. And so we have, again, this patchwork of state regulations across 38 states, which creates challenges for business success. And at the same time, we have less than 9% of US medical schools include cannabis in their respective curriculum, which leads to 67% of physicians are reluctant to counsel their patients because they just do not have an understanding or knowledge of medical cannabis. So why us? Why Cannabis MD? We're uniquely qualified team leadership, myself and all of our team members. We have partnerships with leading medical cannabis subject matter experts across the globe. Cannabis MD is certified in Maryland as an MBE, SBE, and DBE. We're uniquely positioned as a senior level education platform for business senior leadership and policy education in both cannabis science and, again, policy. We have ongoing strategic partnerships with leading medical cannabis companies. And then I am, and some of my team members are actively involved in state and federal policy. Our experts, I've partnered with leading experts, national experts, international experts. Again, if you have familiarity with the industry, these are names that you'll well recognize. Ethan Russo being one, highly well credentialed and thought of physician in the space. Also some state regulators that are leading the industry. So this is our addressable market. If we were to hit the target market that which we're focused on is adult use, retail and cultivation, healthcare, medical education, manufacturing, ancillary service providers. These industries, this niche right here, represents over 305,000 sales points, with these folks generating over $1 billion in revenue. What we're targeting in year one with our investment is a conservative approach of targeting 105 sales points that currently generate 1.3 million in sales revenue. I surveyed our competition. Cannabis MD is stacked up very well against our competition. JN Learning is the education arm of the Journal of American Medicine. Greenflower Media is an online education platform in the industry. And then TMCI has nearly a monopoly on education in the industry for physicians and advanced practice providers who would like to become certified providers in the industry. So what Cannabis MD delivers is we have an ongoing content-rich website. We have personal engagement, ongoing educational programs, customized in-person learning programs, consumer, patient, industry engagement across our entire ecosystem, and then uniquely qualified educators, that folks like myself who have a unique degree in medical cannabis science, MDs, PhDs, and JDs, that some of whom also have this unique qualification. So these are our financials. I'm looking for a relatively modest investment of $250,000 which will be spent on salaries and compensation. I have been bootstrapping Cannabis MD since its inception. This is my second round. I had a prior company in conventional healthcare that I also bootstrapped. So I am very eager to build out. And so you'll see what the primary focus on is salaries and compensation to bring on somebody, professional business development and program manager, legal and professional expenses to lock down the intellectual property, program development. So to engage the physicians and industry leaders that are teed up and ready to work with me to actually create and deliver our programs, where working with state funded grants is you need to do the work and then you receive your money. And so I need the cash flow to be able to execute. So we have our EBITDA is negative in 2023, and you'll see significant growth for the 3 years that I have in projection. So we are 10x in our revenue growth with a $250,000 cash investment. This is our team. So I'm at the top as founder and CEO, and some of these folks that I've worked with for decades now. Kim Van Dyke is one creative director. She and I have been working together for over 25 years. Dr. Matthew Mintz, Tiffany Buckley, Margot Williams, Emily Jacobs, all are uniquely qualified individuals in medical cannabis. And then our advisory board, I have folks that have both had successful exits, and then folks that are on the senior leadership of some of the larger cannabis companies in the US. And this was a tremendous quote from one of the specialists that participated in one of our programs, that he considered a forum, which is our signature event, as the most professional executed program that he has been part of, and how the caliber of our speakers and topics was useful. And it's exciting to see and get this affirmation from somebody who's on faculty at Harvard Medical School. So this is Ready to Invest with Me. I'm an award-winning female entrepreneur. I'm a recognized international expert in cannabis science and policy. I am an honors graduate of the first cohort of the University of Maryland School of Pharmacy, Master of Science in Medical Cannabis Science and Therapeutics, where I'm now an adjunct in any coursework related to cannabis law and policy. I'm founder of Sister Social Enterprise TPAD, which has a foundation, a 501c3, which is very unique in our industry. And that is focused particularly on advancing women and people of color in cannabis STEM. And then I'm a policy and committee member and an advisory board member of a think tank based in DC, the Council for Federal Cannabis Regulation. So if you're interested in partnering with me, you can reach me on Instagram, Facebook, LinkedIn, and we also have a robust library of our virtual programs on YouTube. Thank you so much for this opportunity.
Thanks, Jackie. You can go ahead and stop sharing. I'll kick off our comments. We way too long.
Yeah.
We gave 6 minutes, which is a long time. So a couple of thoughts. I don't think that you need to spend, I think you had 2 or 3 slides on the cannabis industry and where it is and what's going. And I think you can shorten that down to 1 slide, right?
Okay.
I think most people will have at least some sense of, the number of states, medical cannabis, recreational, huge gap, like just 1 slide with more the numbers of the industry, where it's going, what it's going to be, in the next 5-10 years type of thing. And on the medical side, I think what's really missing is the disconnect between current medicine and medical providers of a whole variety and cannabis as an alternative, solution. And I think that that's where you were saying you're going to live, eat, and breathe, but I had a lot of questions. It took me a while to figure out who your customer is. Is it the doctors? Is it the medical schools? Is it the providers themselves? Is it direct to consumer? Maybe it's everybody eventually, but you talked a little bit of your 105 sales points, but I still came away not quite sure exactly how you're going to go to market and who you're going to, sort of how you're going to position yourself. I've also, throughout the whole thing, I'm thinking to myself, is this a nonprofit? This should be a nonprofit. And I'm sort of struggling between, and maybe it's just sort of how you're presenting it, but I'm really struggling with, is this a venture backable, scalable company in terms of, or should this be a nonprofit based upon what you were describing? And then when you got to your financial slide, in your financial slide, it, in my opinion, is nowhere near big vision enough to be a venture backable company. You top out at $500,000 or something in 2020, which is amazing. And that's great. And for a nonprofit or for your own company, that's fantastic. But I have questions, I had a big question mark in my mind as I'm listening, should this be a nonprofit? And then when I saw your financials, I don't think that did you any service to sort of go through the financials in that way. 250K is a really low dollar amount in terms of like a scalable, venture backable, tech enabled company. I didn't see your tech. Like if you told me like, we're going to host events and our events are going to cost this, and we're going to have a membership and our membership is going to cost X number of dollars. And we have a scalable like, do you know what I mean? Like what you said was in terms of what you're doing.
Yes.
But it didn't translate for me in terms of, wow, I see the need. I definitely see the gap. I definitely understand the gap. More and more doctors need to be trained on this. Certainly medical school, like it all needs to be integrated. You're going to have a DIY approach on one end where doctors can go, and maybe that's what one of your competitors do. You're going to have, quarterly events and conferences. Your revenue model is X number of dollars per class per member, and you have an automated, you know what I mean? Like there were sort of different things that I was seeing. I think generally the deck looks great. A couple of the slides were a little too wordy. You were reading a little too much bullet point by bullet point. You don't want to do that sort of on your slides. You want to very few things that just to focus on the slide, and then you talk to it. And then lastly, for you, the about you, that I kept waiting for you, like, oh my God, Jackie is the person to be doing this. Nobody knows her background yet. And you did put it at the very, very end. But for me, I would move it all the way up top because your background and experience is so critical and so credible and so important to what you're doing. I would want to know right from the bat, who is this person? And then immediately I'll know, okay, well, if anybody's going to do this, Jackie's going to be the one to do it. Now let me listen and hear what it is that she wants to do. So for me, I would move that up a little bit earlier on as to why you're the person to do that. So I will pause there and open it up to the group for feedback for Jackie.
Thank you.
Catherine, go ahead.
Yes, thanks, Jackie. Congratulations. It's a big lift. It seems that you've been doing.
Yes.
And it seems like it's had quite a lot of impact already. And as Lisa's talking, I think she's seeing much bigger, and I can understand what she's saying about nonprofit. My question also relates to what Lisa said about the disconnect between what it was before you came along. And I'm wondering if pharma had used components of cannabinoids before, and we just didn't know about it in the public. Had it been used before and you're expanding on something. So there's a connection to something that's already tried and true and safe. I wonder if you could speak to that.
Sure. It's a medicine that's been used for over 5,000 years. It was pulled out of US Pharmacopoeia in 1942. It was in US Pharmacopoeia. Physicians carried it in their bags from I think it was 1842, so close to 100 years. So yes, and then so I can speak to all of that, is that I speak a lot about racial justice or the lack of racial justice, and that our federal regulations are 100-year-old drug policy that is focused on or comes from racial prejudice.
Excellent. Would one of your
Mhm.
clients be able to say that for you? One of the doctors?
No, probably not, because that's what my area of expertise is, and that's why we are educating. So the education to the physicians includes that history of both the history of cannabis being used again for 5,000 years, and then in modern day, so to speak, from the 19th to early 20th century.
Wow. But that's impressive to me.
Yeah, thank you.
Jackie's background, as I mentioned, she is the person to do this. She's been in this industry since its inception and has followed it just incredibly well, and is educated herself, as she mentioned, with all of her degrees. So there's no question in my mind, Jackie, that you're the entrepreneur to make this succeed. And you've come a long way already, for sure.
Thank you.
Any other feedback for Jackie on her deck or her pitch?
Oh, I have one.
Yes, Sharon.
Okay. No, I would say I definitely agree with Lisa. Like, you are so smart, and I wish it would have been put more up front. And obviously you've done a ton of stuff, maybe because everything is so broad when you talk medicine. Is the research maybe about cancer? Is it about pediatrics? Do you hone in on anything specifically? I think that would be really helpful, because
Mhm.
medicine is obviously really broad. And I wasn't too clear if your company had already generated revenue, or what are
Yes.
the revenue streams that you can maybe prioritize.
Okay.
Maybe it was kind of like, like some chart, like we're getting 30% revenue from doctors and X from institutions. Like maybe if it was some type of graph that would help people understand the revenue flow easier.
Yeah, I did start off with 25 pages, recognizing that was way too much. I had everything that you're asking for is in there. And that is, there is so much that I want to share. So
Yeah.
how to break it down. So I
Yeah.
appreciate all these comments.
That's always the trick, right? And sometimes we only have 2 or 4 minutes. We'll say, we've said it before, we'll say it again, this really is meant to be the trailer to your movie, right?
Yeah,
What are
yeah,
like
I always
the,
agree.
the 4 things that you want the listener to walk away from in your few minutes? Whet their appetite. You want them to want to learn more, but what are sort of the big picture, big vision? What's the opportunity? Who's my team, and why am I the person to make this succeed?
Yeah, and one of the challenges, I was thinking about this last night, is gearing up and, for those projections, is I do know where I'd like this company to be in 5 years. Within
Mhm.
that time frame is we're going to have highly likely we're going to have federal legislation. It's going to impact the whole business model.
Right.
So I'm just unsure how to address that. Do I
Right.
have one set based on federal legalization, or some sort of modification of federal policy, another set on, well, here's if we continue as we are?
You know what? I think you could do that sort of as in not a specific projection with numbers, but sort of maybe a graph or a timeline, and sort of
Okay.
estimate, right? We expect within the next 5 years, industry experts and policy makers say that there will be federal legalization. When that happens, we anticipate X amount of change, right? There's also the employment piece. How are employers going to deal with all of this, right? So we expect our current traction, or, to have a 5X, 10X. We will already be the entrenched player, right?
Mhm.
And then it's just a matter of, of numbers for more potential clients once federal legalization occurs.
Okay.
So I think it's definitely worth mentioning this is what the market looks like pre-federal legalization. And this is what we anticipate it looking like post federal legalization.
Okay, great. Thank you.
Any final comments for Jackie? Okay, terrific.
All right, thanks
Well,
for the opportunity.
thank you, Jackie. Always love hearing from you and appreciate both Jackie and Sharon sharing their visions with us today. Hopefully everyone found it useful. I'm going to spend a last minute or so explaining and announcing our new initiative over here at Next, which is Next Raise. I just put the link in the chat. Next Raise is our platform that will be connecting founders and funders. We have a lot of clients that we help fundraise over here at Next, including Jackie and Karen, who's on here as well. And we are launching a new initiative, which launches on a June 1st event. I encourage entrepreneurs to apply. It is a founder funder event. The main event is from 4 to 6:30 p.m. It is an investor showcase. It is invite only. So if you are an entrepreneur in raising a seed to Series A round, please consider applying on our website to participate in the event itself, as well as being selected by VCs for one-on-one meetings the afternoon of the event. So there's a lot going on with Next Raise. I highly encourage everybody to take a look. It is not open to the public. It is really for founders raising and VCs and angel groups that are looking for deal flow. But please check it out. Follow us on LinkedIn, sign up for our alerts. There's lots of ways to stay in touch with everything that Next is doing. So thank you. I'll give everybody back 15 minutes of their day. Let's see, TJ has a thing in the chat. Does not have to be yes, no more than yes. Great comment in terms of the number of slides. So thank you all so much. And we look forward to seeing you at other future events. And if not, and our May Pitchmasters event. Have a great rest of your day, everybody.
Thank you.
Bye-bye.
Bye.